today's content that we did discuss in the video lesson skin diseases. Then this is what we cover now. We did talk about eczema. We talked about eczema, and under eczema we checked on atopic dermatitis, right, and contact dermatitis. Now, based on the eczema, the main clinical presentation that this condition is always a result of inflammation, can be as a result of transmittable contagious, contact related infection, or it can be as a result of hypersensitivity to allergens. Now we have atopic dermatitis. Atopic, from the word atopic, just an external allergen resulted to hypersensitivity. So at most you can see any other clinical condition, we say that it can be acute, subacute, or chronic. So you develop pruritus or the pruritus or pruritic inflammation. These are just like small rashes that appears on the skin, and they are very itchy in nature. They are very small, size of 1 millimeter. Now, okay, so these conditions, they normally associate with a great family history of hay fever, asthma, allergic rhinitis, or any other related allergic reaction. So we normally say that anything which is coming from an allergen or hypersensitivity are pronounced as an atopic. Now, so when we are in the clinical setups and then a presentation like this comes in, check on the clinical significance of what you're seeing, making a spot diagnosis. When it is atopic dermatitis, you have to see the skin lesions, erythema, papules, scaling, scoriations, and crusting. So like pruritus, the cardinal features for the eczema, be it atopic or contact dermatitis, which are subclassification of eczema condition. So you'll see it's a terrible scratching. So that's what we call vicious circle of itch, scratch, rash, itch. That one we did say. So on management basis that you see like any other condition, you have to first know the pathophysiology so that you can be able to explain it to the parent or guardian or the patient himself. So first of all, we have pharmacological and non-pharmacological management. When we say non-pharmacological, to mean that it doesn't involve therapeutic effect of pharmaceutical things like drugs and so on and so forth. So like when you talk about non-pharmacological, you will have to encourage your wearing cloth made of cotton. That in case the other clothes like nylon ones are the predisposing factors. You can also tell them to avoid some food if at all according to your history you realize that food is one of also disturbing or something which aggravates it. Avoid petroleum jelly, that is even case that is it, or maybe steroids. So at most, when you're treating such condition, normally do steroids. Why? Because we do corticosteroids because they are a result of inflammation. We all know that anti-inflammatory drugs are corticosteroids. So the corticosteroids like prednisone, betamethasone, methylbutazone, hydrocortisone, there are plenty of the same. Some of them can be done both intramuscular, that is parenterally, or topical like ointment and creams. Now, according to the note below, which we discussed, that in case of large body surface areas involved, the disease is very severe, one is about to consult dermatologists who may choose to use systemic steroid like prednisone, 20 to 40 milligram daily. And the main complication of infection need prompt treatment. So like when if at all the entire thing is related to infection, then what you need, you give a dose of antibiotics, which is broad spectrum in nature, like otrimoxazole, which can eradicate bacterial infection, fungal, and viral. That is that. Away from that, we did handle contact dermatitis. So we shall check on contact dermatitis as well in the next clip.